I'm not being, that might sound a bit sort of derogatory, but I'm not, because the people of this time, the therapists of those time, were amazing people, and they had developed these skills and they wanted to pass them on. And one way to pass them on was having a structure and a system and a very specific way of doing it. So, if you press this hard, we'll call it grade this. If you press a bit harder, we'll call it grade that. And this is how we can learn. And so there's nothing wrong with that. And it makes sense that there were once some biomechanical laws like the concave convex law, and people could then increase the sort of scienciness of manual therapy by saying something like, we even sort of think about complex biomechanics, and actually if you push a joint in this way and that one's still and that one moves, it's aligning to this law and things like this. So it sounded really good, and it's probably, in doing so, it's probably stretching something here or breaking an adhesion here or fixing something here. So you imagine, that era, all that made perfect sense. And I'm absolutely sure that all those guys and gals were thinking, this is our theory and it needs put into a test. And eventually in the future, research will be done to look at the validity of these things. And it has been done. And this is the point we're at now. So, the concave convex law, for example, has been challenged significantly, and it really doesn't matter which way you push a joint to get the therapeutic effect. And you don't actually need a system of grades to tell you how hard to push. Just ask the patient how they feel and look for effect. So and the trials are consistently showing those things. These trials that sort of compare different approaches to manual therapy, the Maitland versus the whatever versus nothing approach. And you can see, anybody who sort of touched somebody, the person did well, but it didn't matter how they did it. So there's still something very human, very valuable, very therapeutic about touch.